morning. I'm here with Sally Okun, and Insulin Nation wants to know, who is Sally Okun and what does she do?
Oh, it's a great question. Well, Sally Okun is a mom, a grandmom, a wife, a daughter, but I'm also a nurse and have been for nearly 40 years now. And much of my work has been with patients living with very serious and life-changing conditions. Not certainly unlike diabetes, however, I'll say right at the get-go, I'm not a diabetes expert, but I am a palliative care specialist and have worked with patients and families in the community in real-world situations dealing with illness on a day-to-day basis. I work currently for PatientsLikeMe. We're an online research-based platform for patients to connect with each other, to create profiles that they can monitor and track their health conditions with, and ultimately for them to have the ability to learn and share with other people like themselves.
In the talk you gave this morning, you referenced a number of things, and one of them was the connection between patients and data and insight. And could you expand on that?
Absolutely. You know, one of the things that I think most patients don't think about is that they actually are repositories of a lot of data, and that we haven't actually given patients the tools to think about the experiences that they have in a data-driven way. Once you do begin to talk to people about that, whether it's measuring their pain or understanding what a particular symptom might be meaning in relationship to a new treatment that they've started, it gives them some insight into being able to understand how they can actually begin to impact how something might be working or not, and then also communicate more effectively with their physicians or their nurse practitioners or health professionals around the kinds of things they're finding their data is telling them. So if they're noticing that they've started a new medication and they were expecting to see a change in their pain level and they didn't get that, it might be something that they could be monitoring over the next couple of days to see, well, my severity of pain has changed some, but not as much as I expected. So that conversation changes when you talk to the doctor about it. Otherwise, patients might expect, well, my pain will go away. Well, maybe it won't go away. It may be a gradual removal of pain by virtue of having the level of that medication in your blood. And then being able to monitor that over a period of time, you start to see that gradual change.
Yes, and we know that while technology has made monitoring diabetes and monitoring the effects of medication, diet, exercise a whole lot easier than it was 5 or 10 or certainly 15 or 20 years ago.
Yeah.
In many ways, the most fundamental part of diabetes care hasn't changed much or enough. The traditional medical model of the biannual visit, or maybe a quarterly visit, really doesn't fit a disease that requires day-to-day care very well. And so could you comment from your experience on the validity of that observation?
It's absolutely true. I think the clinical experience of being in a doctor's office is really so quite different than being at home and trying to manage your own care. You know, oftentimes patients prepare for their doctor's visits. You know, they sort of get ready. They're sort of thinking, well, I want to be sure that I'm a good patient and I'm going to get in there and just, you know, kind of hear and find out what I might need to do next to keep going with what I need to do. And they're not necessarily putting into the mix of what they want to talk about the things that are really on their mind. When you are working with patients who are really managing most of their care themselves, it's really critical to understand the barriers and the challenges that they have contextually. What are the things at home that keep you from being able to do the things that we've talked about here in the office? I use an example sometimes just about diet. You know, thinking about what it takes to put together a meal is not looking at a list of things you can have or not have. It's really going to the grocery store and figuring out, what do I buy to put in the cart that's going to get me a healthy meal? We should have dietitians in grocery stores roaming the aisles, helping people understand that here's the way that you could put a meal together that will be healthy. People just struggle with those kinds of things on a regular basis, and it's not the kind of information that we're imparting at the clinical visit. It's that real day-to-day kinds of things that someone has to juggle to say, well, I want to eat healthy, I want to buy the fresh produce, but you know what, the canned vegetables are less expensive. So it's thinking about the kinds of things that patients have to juggle on a regular basis.
Many doctors, it's a wonderful term, non-compliant or non-adherent, rears its ugly head very frequently. And I think there's a lot of frustration in the medical community about treating diabetes because people, in many cases, just don't seem to get better. And is that because they're not trying or because what they're trying doesn't work? So now we're back to the data and the need to help patients understand that the more they collect, the more they can learn. But also on the doctor's side, perhaps we need to change the style. And you talked about that today too, and I think you used the term purposeful listening. Can you expand on that?
Certainly. I think, oftentimes when we begin to talk with patients on it, let's say they're coming in for a clinical visit, we sort of have a sense of what our visit's going to be about. You don't have a lot of time. And I would say for the most part, clinicians, nurse practitioners, physicians, people who are meeting with their patients, they're well intended. They really want to be sure that their patients get the information they need to hopefully accomplish the goals that the clinician or the provider has in mind. That in there lies the rub, because oftentimes it's what the clinician has in mind. It's the objectives and the goals that the clinician thinks are the important ones to accomplish because they fit within something that's familiar and built upon evidence for them. You then present that to a patient, and a patient sitting there nodding possibly and saying, well, sure, I understand. Of course, I know I'm going to eat healthy. I'll keep the portions appropriately sized and things like that. And then they walk out and they're sort of faced with real life. And they're trying to figure out how it is I'm going to adhere to the things that doctor and nurse practitioner just told me about, when it's going to be a lot easier for me to just stop at the fast food restaurant on my way home because I need to get back in time to get to work later tonight. So it's really starting to think about ways that talking with patients about what is it that's on your mind, what is it that's keeping you from feeling like you're accomplishing the things that matter most to you. Because I can tell you most patients will leave those visits saying, I can do this, I want to do this, I want to be well. They're not leaving saying, I'm not going to do this. They may be saying, I'm confused, I'm uncertain, I'm scared. And those are the kinds of things that oftentimes don't come out in the visit. So if you listen, you watch, you pay attention to the things that sort of give a patient pause, it oftentimes will open a door a little bit to say, you look like you're a little worried about this. Maybe we should talk about it. Is there something here that maybe makes you feel like you're not going to be able to do it? And let's bring it out.
Right. Yeah, there's a lot of psychology in the treatment of diabetes, and in many cases poorly understood. But self-motivation is obviously the key.
Yeah.
Because even if you see your doctor 4 times a year for, a total of an hour,
yeah.
The rest of that year is on you.
Absolutely. And the self-motivation is not going to come from the clinical visit. It's really and truly, as you said before with data, it's going to, if you keep an eye on what you're doing, if you have a mechanism from which you can see the change over time and you can applaud some of the small victories that you have on a regular basis, that's where motivation begins to take place. And then the connectedness with other people, the social aspect of knowing you're not alone. There are other people who live with diabetes and finding ways, whether it's through group visits or whether it's through social online environments like PatientsLikeMe, where you have the ability to collect data as well as connect. There's a variety of ways that you can do that, but it's really important that the clinical world starts to see the value of social connectedness on the improvement of outcomes, whether it's diabetes care or other kinds of care. It's clearly got a dose effect, and we have to start harnessing that.
And I think the key phrase in what you just said was small victories. Celebrate what you achieve.
That's right.
And understand that you can't always do it.
That's right. Key words there. Keep those in mind. I mean, words are things that I sort of latch on to a lot. Celebrate, accomplishment, victories, as opposed to you didn't reach your numbers or your weight hasn't changed, or the things that make you feel like, oh my goodness, I didn't get anywhere this time, Yeah. But somewhere in that time between the last time you saw your doctor and this time that you're seeing that doctor, you had some small victories, but you didn't give yourself the opportunity to capitalize on those and have those be the self-motivation that you needed to keep going with it. Somewhere along the way, something got you back down again. So.
Well, the funny thing is, if you have diabetes, you see the doctor every day. Every time you look in the mirror.
That's right.
That's,
there is a book by Reed Tuckerson, right? Yeah. So
perhaps we should give everybody white coats.
Yeah.
They'd feel better.
I think so.
Any thoughts about the ability to reach out to physicians and try to persuade them that the art of listening is as important as the art of talking?
Yeah, I think a lot of people believe that listening requires more time. And I would argue that in fact it will save you time if you learn to do it well. And that's why this idea of purposeful listening or personalizing the listening experience, really taking it in with all senses. Patients Like Me is an online environment. We don't see our patients. We don't hear our patients. We're getting data coming in from their profiles, and the richness of the language that patients use when they talk about themselves in their About Me, or they put a little note on the question that says, how are you doing today? They can rate that on a 5-level scale, but they can also put a note in there. And you read that on a bad day, sort of the explanation of what the bad day is about. It's that kind of information that allows you to see a little bit inside what the experiences are like for those patients. And if you don't allow yourself that time, you really aren't going to ever know exactly how to help that patient get beyond the things that maybe are keeping them back. So listening is just an incredibly complex skill. It's not intuitive. We think we are listening when we listen with our ears, but that's not enough. You have to take in the whole perspective.
And often when people hear something, they're not really getting it.
They're already on to the next spot.
Basically the feedback loop somehow doesn't work. One last thought. Many people who have type 2 diabetes could probably benefit from insulin therapy. Many primary care doctors are afraid to prescribe it. And there are a lot of reasons why they're afraid, some of which are pretty legitimate. But ultimately, to win the battle against diabetes, which is what you were here talking at the Jocelyn conference about this morning, we've got to make an impact on the primary care physician. And I wonder if you could just leave us with some thoughts about how people like you can help do that through existing networks or perhaps the creation of new ones that don't focus on products or you don't have to teach a doctor how to practice medicine. What you do have to teach them how to do is how to communicate.
Absolutely, and I think you raise a great issue, because not only are primary care physicians reluctant and maybe a little bit uncertain about how to effectively use insulin in the management of diabetes, but patients oftentimes see insulin as the thing that sort of is emblematic of things are just bad. Things have just gotten so much worse that I have to start insulin. And in fact, as we know, if we can address patients' sugar, blood, and I'm going to use the word sugar because that's what most patients use. When you start addressing their numbers and really thinking about how insulin can be effective quickly, can actually show patients that we can address this, we can get on this together, we can collaborate together to effectively get you to a point where we will get your numbers to where they will be therapeutic and where you will actually can live well with these. Then you can begin to have a patient understand that the numbers are one thing, how I live with this is another. So if you can help me get to the numbers, doc, do that. Then let me concentrate on living as well as I can, living the diet ways that you're helping me understand that I need to put into my life, helping me think about even the small steps I can take in taking a little longer walk than I took the day before. Those are the things I can do. If you have a tool that you can do, that you can use, that's going to effectively get those numbers where we need them to be, let's collaborate and do that together. So trying to get through that fear on both sides of that fence, I think, is important for the physicians as well as for the patients.
Sally, thanks very much for your time. Your insights are great, and we look forward to talking to you further as Insulin Nation progresses.
Great.
And so do you.
Thanks.
Thank you.
Thank you so much, Chris. It's been a pleasure to speak with you.
Okay.